Joined. My name is Adele White. I'm a project manager for HCET. I'm going to let our presenter introduce herself later, but right now I'll let my colleague Kara introduce herself as well.
Hi, my name's Kara Berg-Ronick. I am the Director of Health Strategy and Advancement with HCET and also the Director of the Midwest Trauma Informed Training Center here at HCET. Thanks so much for joining us today.
Yeah, thank you all for joining us. Cassie, would you mind sharing the slides, please?
Sure thing.
All right. So, official name of this, which y'all know if you have signed up, is Care Consent and Calling It In, Mandated Reporting Through a Trauma-Informed Lens. This is a super exciting topic, and we're so grateful to have Cassie here with us today to talk through it because as you know, if you're here, you know this is pretty complex. So we're super grateful for Cassie to take the time to talk to us today. Next, please. So as I mentioned, Kara and myself work for HCET, Healthcare Education and Training. Some of you may know us, for those that don't. We are a nonprofit that focuses on supporting people like you, healthcare workers, public health workers, in sexual and reproductive health education. And we really believe that every single person has the right to high quality healthcare education and healthcare that's evidence-based, medically accurate, all of those important things. Next, please. And then I'm going to let Kara talk about our Midwest Trauma Informed Training Center.
Yeah, so in 2023, we formed MTITC kind of in response to community need, um, recognizing that trauma-informed care was becoming this like hot buzzword. We were hearing a lot about it, but that especially in healthcare, people were saying, but I don't, as much as I appreciate the concept, I don't know how to operationalize it. What do we do with this? And also recognizing that a lot of that work was happening in silos with a lot of people doing amazing things around this and not having the sort of resources or mechanisms to share those best practices and what they were learning. So we formed MTITC with the goal of transforming the landscape of health and human services by giving professionals the knowledge, skills, and support they need to make trauma-informed care standard practice, knowing that this will help us form stronger and better health outcomes for our patients, for ourselves as providers and staff, for our systems, and ultimately for our communities. Next slide. Cool. Back to Adele for housekeeping. Thanks so much, everyone.
Yeah. Thank you, Kara. So during this webinar, what makes it really easy is that for your questions, y'all can submit questions at any time. Instead of putting questions in the chat, if you can please click the Q&A option at the bottom and add your question there, then it saves it so we can go over all the questions at the end and it won't get lost in the chat. You can submit your question anonymously if you prefer as well. So that's nice that that kind of gives you that option. Next slide, please. And then if you would like to see a transcript, subtitles, there's a little CC at the bottom of your screen for closed caption. Just click that and then you can see the options for live transcript if you prefer to see things written out. Next slide, please. And then at the end of this webinar, we have a QR code for an evaluation. We really appreciate hearing your feedback about this webinar and ideas for future topics, what y'all want to hear about. If you experience any technical difficulties during this webinar, email my colleague Jen at updates@hcet.org. Updates@hcet.org. Next slide, please. And then we do a lot of webinars informed by the topics that you all want to hear about. So check us out on our social media and our website. We're at hcet.org on Instagram and Facebook, and hcet.org is our website. Next slide, please. And I am turning it over to Cassie to introduce herself and jump into our content. I'm super grateful that you're here, Cassie. Thank you so much.
Yeah, thank y'all for having me. Hi all y'all. My name's Cassie. I go by she, her. I'm a nurse, and today we're going to talk about mandatory reporting, but with that trauma-informed perspective, right? Y'all saw my bio already, but just like the highlights, I've been a nurse 19 years. A lot of that has been spent working in ICU. I do work for public health now. However, I spent 7 years as a forensic nurse. I loved it. I went and got a master's degree in forensic nursing. And then I suffered entirely too much vicarious trauma and I had to step away. So this is where I'm at now. So we'll just jump straight in. Um, so here's our learning objectives. I'm not going to read these out loud to you, but the gist of what we're here to talk about today are mandatory reporting laws and the impacts that these have on our patients and clients, because that helps us approach reporting with more awareness and hopefully to implement measures that will minimize the effect it has on those we serve. Couple of general disclaimers. While I do work for Public Health Madison and Dane County, I am not here today representing them. I am here as myself, and the opinions and views shared in this presentation are my own. There's no conflicts of interest, and I try to reference and credit people's work throughout here. This presentation was built on the work of some really great people out there, and I do have them listed on a slide for y'all. A couple of quick ground rules. I think everybody's already muted, so that may be a non-starter, but if not, please mute yourself. I really want you to come to this with an open mind. Be ready to explore ideas that may challenge what you currently believe, right? We all come from different walks of lives, and we've had personal experiences that really inform how we move through this world and interact with others, and then how we process situations, new information, etc., right? Sometimes that new information makes us uncomfortable, and we don't always respond well. We get defensive. We say, oh, that's not my experience. The people I work with don't do that. They don't believe that. I just want us to all remember that our experiences are our own. They're not that of our neighbors. And so opening ourselves up and abandoning that defensive reaction can really help us see how people are being impacted by how our society is, right? I'm going to present some information and views of mandatory reporting that is maybe unfavorable, and maybe some of you already hold those views, right? But before we can really discuss trauma-informed care, we do need to understand how our systems aren't always designed to, the ones we think are designed to help, sometimes they wind up creating more trauma, right? It's okay to pass. I'm going to ask you to participate from time to time. You don't have to. If you don't want to, that's fine. You're here for the ride, and that is perfect. I do want us to treat each other with kindness and respect. The chat is where nuance goes to die. Tone is often misconstrued. So let's try not to assume ill intent. And then I will try to pause every so often to look for any questions that get dropped in the chat versus the Q&A. So yeah, if you're comfortable, just take a minute or two, say hello in the chat. Let me know who you are, where you're from, what is your role? I know there's a variety of people on the call today. So how are you serving people, and what populations do you serve?
All right, welcome, Kate. We have Kate, a forensic nurse from Milwaukee. Thanks for sharing.
Yeah.
All right, Allison, forensic nurse in Southeast Wisconsin. Heidi, public health nurse. Megan, Val. I recognize some names. Kelsey, Angela. A lot of forensic nurses in the house. Thank you so much. Public health nurses. Carla, Adams County. Clark County.
Oh, we got somebody from
Allegheny.
Indiana.
All right.
So not just Wisconsin, yay.
Yeah. Portage County. Ashley, Reproductive and Health and Family Planning Unit. Awesome. I see different areas of
Yeah.
Menominee, Menominee County. Wonderful.
So sounds like primarily a mix of public health folks, nurses and DIS, as well as a couple of forensic nurses. And now I'm a little nervous because of the FNEs in the room, but hey, we're going to do it. Okay, so let me move that back over and come back over here. So we're going to start by talking about what mandatory reporting is, how it came about, how it's impacted communities over time. But first, kind of drop a little bit in the chat about what do you think about when you hear the term or the phrase mandatory reporting? What is it? How does it make you feel? What are your general thoughts on the topic? And if you don't want to put that out there, that's cool. Hold that definition in your head, write it down, look back at it later. Wait, am I putting the chat directly into where everybody can see?
So are you typing something in the chat right now? You have to make sure
I
You
keep moving it
write.
back and forth so it's not in my view, but I realized, am I sticking it right in the screen that I'm sharing?
Oh, we can't see it on your screen. You can see it, but we can't.
Okay, good.
Yeah.
Anybody want to share what they think of? Legal requirement, yep. Policing, yeah. Safety net for children, but can be a deterrent for people getting services. It's scary because it results in investigation. You think about kids. Definitely. So, the definition that I'm using today is this one here. Reporting is a combination of policies, practices, and state-based laws that require certain people to report specific harms to government agencies. That comes from Shannon Perez Darby of the Just Beginnings Collaborative. Um, let's kind of take a look at that one piece at a time. Most of the definitions of mandatory reporting do focus on state laws that require professionals to report. But the reality of this is that our biases, our workplace protocols and policies, or the lack thereof, all that combines into like this practice that we engage in. Um, just looking back at the chat real quick, I often felt like when I was actively concerned about someone, it would get screened out. And when it seemed like this person was safe, but I still had the requirement to report, that's when it would be picked up. So frustrating. Yeah, definitely. It is very frustrating. When in doubt, report is how I used to do things, but now our CPS agency has more parameters and I struggle to know why. I'm glad you said that because we're going to get into the why you shouldn't just report when in doubt, why you need to engage those critical thinking skills, right? Um, so I'm going to quit looking at the chat, but coming back to this, looking at this, certain people, who are certain people? This is going to vary from state to state, and quite often it does focus on people in professional roles. However, some states do have what's called universal reporting, and that's where everybody in the state is considered a mandatory reporter. You do want to pay attention to the wording of the statutes, though sometimes may and can are two very different words in that sense. One requires and the other says, yeah, you can do this, right? Um, Looking at the next part, specific harms. These also are going to vary from state to state and mostly intended to focus on those who are perceived to be vulnerable populations within our communities.
Pardon
Um,
me, Cassie. It's
yeah.
still on the slide that says what is mandatory reporting.
Oh, the definition didn't pop up?
Yeah, right now it's what is mandatory, and on the sorry, the definition is up there. I just want to make sure you're still on. You're not on a.
Yes.
Okay, so I'm sorry
Yeah.
about that. Okay.
Nope, you're good. You're good. Um, what was I saying? Oh yeah, talking about vulnerable populations. You're going to hear me say this repeatedly throughout the presentation that oftentimes these statutes are very vague in their writing. They're not very specific. That creates a lot of confusion and it leaves interpretation up to us, to our workplaces, and more specifically to the lawyers whose jobs it is to put that company or healthcare entities first. When it comes to the vulnerable populations, usually we're talking about minors, the elderly, people with intellectual or physical disabilities. Elderly can vary state to state. And I want to say in Wisconsin, it's either 60 or 65 is where that line is. And I'm thinking to myself, I'm almost 50. That means I'm only 11 years from 60. I feel like I have my faculties, right? I don't feel like a vulnerable population. For today, though, we're primarily going to focus on minors, right? Coming back to this definition, government agencies. Well, which ones? Your state laws should tell you who you're going to make the report to. Sometimes you have the option. You either call somebody like Child Protective Services or whatever it's called in your area, or a law enforcement agency. And then one of the things you want to make sure that you're aware of too when you're making this report, which CPS are you calling? Which law enforcement agency are you calling? It's going to vary based on which agency as to where it happened versus where the person lives, right? So these are things you need to know before you're making a report. Before we get into that, let's talk a little bit about kind of a brief history of mandatory reporting laws. Today's practices come from modern laws, but a lot of these laws are rooted in reforms of the past, right? There's always been people that have been concerned about child welfare. Many have thought they had the best of intentions in mind when lobbying for laws and policies, but sometimes creating more harm than good. White supremacy, hegemony, as well as heteronormative ideology have driven many of these reforms over time. And yes, that sounds like a lot of academic or activist speech. So before we move on, let's break down to know exactly that we're on the same page. White supremacy being the being the ideological and systemic structure that white people are superior to all other races and should dictate ideology politically, economically, and socially. Hegemony, meaning the dominance, leadership, or superior influence of one group over another. That influence often means that its ideas, values, and controls seem natural or unavoidable for the rest of society, even if it's not under direct force. It's just the way things are, right? Sounds a lot like white supremacy, but it can also denote a predominant religion or a ruling class, and also the haves versus the have-nots, right? Heteronormative, meaning the societal belief and assumption that heterosexuality or being straight is the default, natural, only normal way of being. So I want to keep those definitions in mind as we move forward because those constructs have shaped our societies and they drive our biases and they often inform our laws and how we react, right? Getting back to the historical reform aspect of this, some of those reforms have been great, right? Child labor laws, compulsory education, while others have been horrific. Talking about the US and Canadian Indian boarding schools where Indigenous children were removed from their families and tribes and forced into white Christian-ran boarding schools. Many of these kids didn't make it out alive and their deaths were kind of hidden from the outside, while those that did survive had their culture and their language stripped away from them. There was also the orphan train movement where poor children from urban homes were removed and transported across state lines to live in white homes, which was another form of family separation and meant erasure of their cultural identity, their practices, and their heritage, right? Often these were framed as a measure to protect children. And these practices were also intended to control non-white populations and force them to conform to white Christian society. When we move into modern times, back in 1962, there was a paper written called The Battered Child Syndrome, produced by two doctors, C. Henry Kempe and Brant Steele. This paper was written to kind of help doctors determine, is this physical child abuse? And also to help kind of create or label that as a medical diagnosis. And it also discussed the effects of child abuse and basically said doctors are very well positioned to detect and report child abuse and neglect. And really, they have an ethical duty to do so. Following that paper, you started to see mandatory reporting laws popping up in states, primarily focusing on medical professionals, but soon a lot of other professionals started to get listed as reporters. By 1965, there were about 46 states that had these laws. And then in 1973, we get the Child Abuse Prevention and Treatment Act, CAPTA. This requires states to have mandatory reporting laws that met federal guidelines in order to get federal funding. That funding was intended to create child protection agencies if they didn't already exist, as well as to establish hotlines to report child mistreatment. One of the things that I learned this morning is that there were child protection societies that started forming in the late 1800s, but they weren't state-ran agencies, right? But coming back to this, CAPTA, the senator who was the driving force behind that bill, Walter Mondale, had heard the discussions around what had been identified as drivers of child mistreatment. He ignored those. He actively dissuaded people from having conversations because he wanted this legislation passed. He wanted a landmark bill, right? And what were those drivers? Poverty, racism, unemployment, and a lack of resources. Mandatory reporting laws don't address these factors, nor do they require providers to offer supports to address these issues. CAPTA has been revised many times over the year, adding to what is considered child abuse and maltreatment, with the addition of, child sexual assault, drug exposure. The requirements to receive funding has also changed many times, and there's a lot of states that aren't actually compliant with these requirements because oftentimes these requirements are expensive to enact, and the funding they receive is not adequate. And what they get through their state is often not adequate, right? Sometimes these changes to the federal guidelines are knee-jerk reactions to specific events or even political motivations and maneuvers. Talking specifically about the 1980s war on drugs, on crack babies, and more recently, reactions to trans youth. In 2022, Governor Abbott of Texas issued a directive that defines certain gender-affirming services as child abuse. States can enact requirements or guidelines that go beyond what the federal government does. So I know not all of you are from Wisconsin, but I am going to use the Wisconsin statutes just to jump around and show you an example of what these laws can look like. So let me find my screen sharing. Does it give me? Okay. So this first one is going to be the persons required to report. So when you first jump into the statute, you get a lot of your definitions, right? This is to tell you this is what we mean specifically. Child is not defined in this section, but there is a Wisconsin statute that defines a child as anyone under the age of 18. So these are our mandatory reporters in Wisconsin, starting up here at physician, going all the way down to juvenile correction officer. There are some groups in here that are broad sweeping categories. So if you look at number 9, a medical or mental health professional not otherwise specified in this paragraph. You come down to 16M, a school employee not otherwise specified in this paragraph. So that means your custodians right there, right? When I was looking these up, I realized that there's actually a gubernatorial mandate in Wisconsin that makes all employees of the UW college system mandated reporters. I am not clear on if that includes students who are performing a work study for the university, right? You are going to have some exceptions when you get down here. To, the people that are mentioned up above. So when we get down, so this one addresses, I say this one like y'all can see it, except as provided. This one is in addition, in reference to clergy, shall report reasonable cause to suspect that a child seen by a member of the clergy in the course of his or her professional duty has been abused. And then also it talks about if clergy notices other members of the clergy performing the abuse. However, when you get down to 3 here, a member of the clergy is not required to report child abuse information under, and then you do have, instead of writing it out, they just reference it and link it back. So then you have to go back and see what are they talking about. They are not required to report anything they receive solely through confidential communication made to him or her privately in a confessional setting if he or she is authorized to hear or is accustomed to hearing such communication and under the disciplines, tenets, or traditions of his or her religion, has a duty to or is expected to keep those communications secret. Those disciplines, tenets, or traditions need not be in writing. So that's an exception. When we get down to healthcare workers, you get your definitions of who's a healthcare provider, what is the healthcare service, family planning services as defined. And here you got to jump to another statute if you want to know what that is. Pregnancy testing, obstetric healthcare, screening, diagnosis, and treatment for sexually transmitted diseases, except as provided under, and this will bump you back up here. See, I lose my place when I'm reading through these. The following persons are not required to report as suspected Healthcare provider who provides healthcare services to a child, who obtains information about a child who's receiving or has received healthcare. And then you get down here what some of those exceptions are. Um, Sexual intercourse or conduct is likely to have occurred with a caregiver. So that's caregiver, that's an adult in their life, not a peer. Um, One of my other favorite ones in here is that a child has suffered or suffers from a mental illness or mental deficiency that renders the child temporarily or permanently incapable of understanding or evaluating the consequences of his or her action. Which mental illnesses? Right? What degree of mental illness? Medicated, unmedicated? Who's making this call? Right? My other favorite, that the child, because of his or her age or immaturity, was or is incapable of understanding the nature of consequences of sexual intercourse or sexual contact. How do you define immaturity and how do you judge immaturity, right? Um, it's extremely subjective. There was something else in here I wanted to point out, and of course, I'm looking at it and not my notes. It does say in here basically that children can come to you and talk to you about sexual health services. That is an exception, right? Um, and you don't have to make a report on that. One of the other ones I want to point out, so on the slide I have here, what is abuse? Because remember, you are supposed to report any abuse or neglect or reason to believe that the child seen in the course of those actions has been threatened with abuse or neglect, or that abuse or neglect shall occur. When you jump over here, abuse is defined as physical injury inflicted on the child by other than accidental means. How do you define physical injury? Is this, emotional harm? Is this bruising? Is this, you can see a cut? How is that defined? And keep in mind that spanking is allowed in the state of Wisconsin, but spanking causes physical injury. So there's contradictions. I am not going to go through all these laws. There's a lot. You can see, especially when you get down here, sexual intercourse or sexual conduct under this one, this one, this one, this one. And if you want to know what they are, then you got to jump to it. Oh, this deals with sexual assault, and this deals with charging. That's not something we deal with. We're not investigators, right? This one's going to deal with sexual assault of a child. Again, deals with charging primarily, and then that's how it's defined. Repeated acts, but also this gets into class of felonies and such. One last one. This one regards foster care, right? So that's a little exhausting, right? Let's come back to our presentation. Except now I can't find the right screen. I'm sorry.
Let's see. Take a moment, take a deep breath. Right now we're on Wisconsin state legislators still. If you need to
Yes.
close those to go back to PowerPoint, I
There we go.
sometimes have to do that.
Got
Okay.
back to it. All right. Sorry about that. Got back to it. Um,
Oh, now I'm so sorry. Now we can see your notes, so you might just have to go to display
oh.
settings.
Oh, display settings. Does that change it?
Yeah, if you click swap presenter and view slideshow, that might work. No, or sometimes you have to do it in PowerPoint if it doesn't work there. If you'd, um,
Did that do it?
it didn't. Do you want me to share my screen? What's best for you?
Let me stop for a second.
Yeah,
Apologies. And
no
then we'll go
worries.
back into it.
No worries.
So that should
Just,
be the right screen.
yes, it is.
Okay. Thank you. Apologies again.
You're good. You're good.
So just looking at that, is anybody else a little exhausted? You got to jump around to find what you're looking for. Much of the verbiage that is used is subjective. There's another statute I didn't pull up that defines child abuse as great bodily harm, but that's not specific, that's not measurable. Um, and then also, how are you measuring immaturity? We aren't investigators, we're not lawyers. These are not what we're supposed to be doing. Even for the FNEs in the room, we're healthcare providers still, right? We're not that investigator. That's not our role. There's a lack of consistency here too. Clergy are afforded confidentiality, but healthcare providers are not. And I'm just going to fully say I have not delved into any additional laws around clergy as mandatory reporters, nor am I a member of the clergy, so I don't know what conversations they're having regarding these laws. But I do find it a bit inconsistent. For your state, you really do need to locate the statutes that describe who is a mandatory reporter, who you're going to report to, all of those things, right? Because anytime there's confusion around what does this mean, that's where the harm starts. And we will talk about that more later on in the presentation. Well, so, well, now my slides won't go forward. There we go. We're gonna have a little poll here, and I want to know what you think. Do mandatory reporting laws conflict with the code of ethics or values for your profession? Do these laws run counter to best practice? And what I
Thank y'all
did,
for answering. I see some stuff coming in.
are we able to see that on the screen?
Yeah, let me see. So y'all can't see it right now. Let me see how I can. Oh, I think it's because, hold on, let me see if I can do this. I know it's because you're screen sharing, but shoot, there doesn't seem to be a way.
Might just have to tell them the answers as it comes
Yeah.
up.
So
Okay,
right
yeah.
now, we have about 35 of percent of people saying yes, 22% of people saying no, and 43% saying unsure. And there's a total of 33 people who have participated. So
Okay.
yeah, it's kind of balancing still 35% yes, 23% no, 42% unsure. So a lot of gray area here, it looks like.
Yeah, definitely. And with mandatory reporting laws, it can sometimes feel very gray if you're not used to looking at these or you don't do reporting on a routine basis. So, all right. We'll come back to this poll later on. Real quick.
Oh yeah, now it says, Angela, you're right. There was an
Yep.
option to share results. Now it's sharing. Okay.
Okay.
So I'll close that one, after a minute, yeah, if y'all want to take a look.
Yeah, just a real quick a comment. The legislation is confusing as you can charge for sexual assault for a 15-year-old, but not necessarily have to report, i.e., a 15-year-old having sex with an 18-year-old. Yes, you can, and you don't have to report. Um, correct. All right. So, mandatory reports are not supports, especially when reporters are entwined with the very programs people turn to for help. I realized after I wrote that out, that's a little bit of a tongue twister. So mandatory reporting laws, they were written as an intervention to protect children from harm, right? This was intended to be a way to try and stop that harm. They were developed specifically to protect children from harm from the adults in their life, which I want to remind folks that does not include peer-to-peer harm, although quite often we do make mandatory reports when it does come to peer-to-peer harm, right? Um, think back to the history of how those laws came into being, right? CAPTA was introduced and championed by a man who dissuaded conversations around the root causes of child maltreatment, those being poverty, racism, unemployment, and a lack of resources. Sometimes it's as simple as not having a phone in your home, right? The law only says you have to make this report. It doesn't provide any directive about offering supports first or even at all, or, if those supports even exist in your area. Um, and any resulting investigation does not always mean that those resources are just going to manifest, right? It's just an investigation is done and decided, is this a case? Is this not a case? Let's see what's happening and going on here. People should not have to put themselves in the path of the authorities in order to get access to those resources, to be told about those resources, right? I'd take it a step further in saying that a disclosure of harm should not be the bar for being made aware of the resources within your community. And some of the programs or resources out there to help people, you can't even access them unless you are making a report to law enforcement. So while the intentions behind mandatory reporting may have been very good, I'm going to keep saying this, those laws are subjective, um, and they can be confusing. And we think we're doing harm because our job is to identify that harm and tell someone about it, right? There's actually no research or evidence that demonstrates that reporting can be an effective intervention, but there is a significant amount of research that shows that reporting is harmful. So when those laws were first enacted back in the 1960s, there were about 150,000 cases being reported annually. In 2019, and this was the most recent data I could get to, the reports that break down mandatory reporting, kind of like the statistics around it for the year, it would not come up. It kept saying PDF is not available or something like that. But by 2019, there were 4.3 million cases reported. So we went from 150,000 to 4.3 million. That's a huge jump. That's like about 200 or 2,000+% increase in reports. So why? Well, first off, that group of reporters started with medical professionals and it just kept growing and adding people. And in some places you're adding, the average person out on the street, right? Um, in addition to that language being vague and confusing and subjective, these folks that are being added as mandatory reporters, they're found in the very places where people go to when they need help, right? You're dealing with somebody abusive in your life, or you've been hurt by that person. You go and seek health care to make sure your body's okay. And the next thing you know, somebody's making a report without your knowledge, right? Many, I already mentioned this, that, a lot of folks believe when they make that report that they're going to receive support and resources. That's rarely the case, right? Quite often the report just winds up making these situations worse. Of those 4.3 million cases that were reported in 2019, only about 10 to 16% of abuse and neglect reports were substantiated. That's a significant amount of reports that were made that were not substantiated. And the FNEs in the room will know that when we inform law enforcement of an assault or something like that, those cases are not always substantiated. Just because our legal systems do not find evidence of harm does not mean harm did not occur, right? But in these situations, the data is saying only 10 to 16% of these abuse and neglect reports are substantiated. 74% of the reports were for neglect concerns. So tell me in the chat why you think neglect is the more common complaint. And while people are, dropping their thoughts on that if they want to, I just want to touch on the penalty for not reporting, right? Many people report when in doubt because of fear of failure to report, right? The consequence for not reporting is going to vary from state to state. The most common refrain being loss of licensure, right? The decision on licensure usually is up to the state board that issues that licensure. I tried searching for information on how many nurses in Wisconsin have lost their license due to failure to report. I couldn't find information that's helpful. You can see who's lost their license or had it suspended and kind of a vague reason for why, and I'm assuming that's for privacy. There is actually a research paper out there that does take on the topic of what happens when people fail to report, and it's called All Bark, No Bite, which is basically saying these laws are, they're loud, they get your attention, but they really don't have any teeth. And it did look at cases in Ontario where they could find information about this. They found no people disciplined on failure to report suspicion. They only found people disciplined for failure to report a direct disclosure. So taking a look at the chat, Easier to observe neglect, maybe because people assume parental neglect if young people are having sex, kid not cleaned, cared for as we think they should. It's more obvious in some situations, such as a child not being clean, dirty clothes, wearing the same clothes daily, not coming with their lunch on a regular basis. As a former school nurse, chronic head lice. I'm going to come back to your comment in just a minute. And I'm going to pick on Heidi just because I know her. Uh, could be broad. Neglect can be more chronic as opposed to an event or series of events. Full disclosure, my son is on the spectrum. He wears the same top every day. It is a sweatshirt he loves. He feels the most comfortable in it, and he skips meals. I have worried time and time and again that I'm going to be reported for neglect because he's this string bean of a kid, right? But yeah, it's observations, right? Things that we feel can inform us on whether this child is being neglected. Here's some of the things that can happen when we wind up over-reporting. One of the things that research has shown very often is poverty, which is not a crime, is reported as child mistreatment or neglect, which is an actual crime, and that can lead to investigation. Being poor. Oh yeah, referencing kids wearing the very same soiled clothes. Yes, I definitely agree that can be concerning. So, um, being poor is not a crime, but it can explain why that child may not be dressed for the weather, why they may be recycling clothing, why they may be missing meals, why they have poor health or poor dentition, teeth or something like that. The research has also shown that when we look at investigations through the lens of race and ethnicity, Black, Latine, and Indigenous families are more likely to be investigated when a report is made. Roughly half of our Black and Indigenous populations have been investigated by CPS during their lifetime. That's kind of wild and terrible. When you consider gender, women and trans or other non-conforming people are more likely to be reported when they're seeking help for a situation that they're dealing with. These investigations are often intrusive. People are coming into your home, they're scrutinizing everything, they're subjecting you or your child to physical examinations. Not always with the physical examination. Excuse me. The one thing I want to say about that, because I put that in there and then I thought back, like, no, we get consent or seek assent from children whenever doing physical examinations. But the authorities sometimes can strongly imply that you need to do something. My favorite was always, we need to collect your clothing you were wearing. Well, do you have a warrant for that? Have you explained what's actually going to be tested versus why you need all those clothing? It's the language used to kind of convey that authority, right? It's not saying you have to, it's just we want, right? So invasive examinations, invasiveness of people coming into your home and scrutinizing what's going on, right? When children are removed from the home, that does create a lot of emotional and psychological damage to the child. And if parental rights are terminated, then they're not always put with their siblings in a foster system or homed with family if there's home. There can be loss of access to community, sometimes erasure of their cultural identity. So how does this differ from the orphan trains or from boarding schools? When you have a person who's a survivor of physical or sexual abuse and that investigation is unfounded, sometimes that person's situation gets worse, right? In a survey of callers to the National Domestic Violence Hotline, about 50% said the report made the situation worse, and 10% said it changed nothing for them. Their abusers retaliate, the violence gets worse, and the abuser has better learned how to hide their actions or how to circumvent the systems, right? When a report is made without a person being aware, it takes away that person's agency and self-determination. They've already lost control over the situation when they've been abused or assaulted, right? And we like to be in control of the situation because that makes us feel safe, that makes us feel confident. Mandatory reporting will often continue that trauma of the assault because that person's voice is not considered in what happens next, especially when they're not told that report's going to be made. And one group I failed to mention, previously is undocumented individuals. The obvious concern being that when they're seeking help, they open themselves up to discovery. A lot of places have put policies in that, like, if you come in because of abuse or an assault, we're not going to, question your legal status, right? That's not universal, right? That doesn't keep the fear away, nor does it keep government powers away from hospitals, churches, or other agencies where people are turning to for help. And we've seen that in the news. And I realize I'm getting close on time, so I'm going to start running through a lot of this a little bit quicker.
Cassie,
Um,
we have until 1:15.
oh, okay,
So,
good.
like, as long as
Okay.
we have time for a few Q&A, you're good.
Yeah.
So,
All right. Sorry.
you're good.
Um, when we fail to provide resources people meet their basic needs or their family's basic needs, so we're thinking Maslow's hierarchy, right? When we don't meet those needs and instead we punish them with over-reporting that is biased, it leads to intrusive investigations, separations, and more trauma. We're becoming a part of what people see as family policing. This definition came from a video I was watching by an organization out of the state of New York, a system of surveillance, criminalization, and punishment that weaponizes ideas of safety and the threat of family separation to control Black, Indigenous, Latine, low income, queer, and disabled parents. The system includes and is driven by Child Protective Service agents, police, mandated reporters, service providers, lawyers, judges, and lawmakers. So this takes us back to those early laws where the predominant society knows best and will ensure that folks do better, right? Sounds horrible from our perspective, but try being somebody that's being reported on for something that is poverty, something that is a result of systemic failures. Um, it becomes hard to trust a system that doesn't seem like it has your best interest in mind and just continues to demonstrate that over and over with same actions, different names. Um, it doesn't help you locate the resources within the community you need to correct what's going on or to make the situation better. And as a result, people often stop seeking out services, and sometimes their situation gets worse. They're not coming in for healthcare because they don't feel that they can trust that provider. Um, so earlier I mentioned a survey of people who had called a national domestic violence hotline. That report is from a survey that is called There's No One I Can Trust. And as you can see from the slide, it was kind of looking at the impact of mandatory reporting on domestic violence survivors. The participants in this survey were adults and minors. I can't speak to the laws around adults experiencing DV in other states, but in Wisconsin, it's not a reportable offense for adults, right? And there's been debate over that due to the wording of some of the state statutes. But I think the vast majority of us, we're not contacting the authorities unless that person says, I want to make a report. There are some situations, but sorry, they're not that often. So this survey found that 1 out of 10 callers had a report made about their situation. More of those people that had reports made were trans or non-gender conforming folks. Of those people, about 30% said they had some form of preparation made before that report was made. The report did not define preparation. Only about 15% of them said they'd been warned ahead of time that they were working with somebody designated as a mandatory reporter. And most of the folks who were reported were warned that they would either be reported to police or to Child Protective Services, but there was about 12% of the people that were like, I'm going to be reported, but to who? Like, what's going on here? And what's happened is that it's deterred people from seeking help. Because it leaves them with no one they feel that they can trust. About 60% of those survey participants said that they did change their mind when they were told that they were talking to a mandatory reporter. That's really disheartening because obviously we come to this work wanting to help people, but we can't help them when we don't know what's going on, right? But that fear of the report, of that fear of family policing, it's a deterrent. And even if that person hasn't personally experienced it, they know somebody that has, right? They don't live in isolation. So they see what happens to other people around them that are like them, and it just creates this culture of silence where they can't get help from anybody. Coming back to this, the statistic I have on the slide, 34% of those surveyed said they had not asked for help because of the fear of the report, and over half of those people were either under the age of 18 or they were transgender. These folks they're scared of being reported to the police, essentially. So the takeaway here is that mandatory reporting laws create harm, they erode trust in our systems that are designed to help, and they prevent people from seeking help. I'm going to give you the link to the report if you want to take a peek at it in your spare time. You can get a little bit more information right there. So, coming back around to this poll question, do mandatory reporting laws conflict with the code of ethics or the values of your profession? For those of you in the meeting that are nurses, within our code of ethics, we have provisions to practice with compassion and respect for the inherent dignity, worth, and unique attributes of every person. A primary commitment to the recipient of nursing care, whether an individual, family, group, community, or population. A provision to establish a trusting relationship and advocates for the rights, health, and safety of recipients of nursing care. So do these laws that essentially deputize us as agents of the state, do they sit in tensions with these provisions?
All right, I will launch the poll again. One moment, please. All right, the poll should be up. Yep, I can see answers coming in. We'll leave it up for about a minute so people can pop their answer in. So far, we've got quite a few yeses, a couple no's, unsure. I'll give it about another 15 seconds and then I'll share the results.
So what were the results last time? Do you remember?
Yeah, it was about half of people unsure and then close to a quarter of yes and no last time. And
Okay.
I'll pop this one up now. I'll do end poll and share results because it looks like we've had quite a few people participate.
So more of you now thinking yes, that these do. Yeah, no worries.
Yeah.
Sorry, we got a little interlude real quick, no worries. So we'll go ahead and move forward here. So how do we balance our professional and personal ethics, code of ethics with the legal expectations of mandatory reporting laws? Because, right, legally we still have to do this, right? We're going to use a trauma-informed approach and harm reduction tactics. So, as Cara mentioned earlier, trauma-informed, it's this buzzword, but what does it mean, right? So I took these from the SAMHSA website. I did reword them a little bit, but basically we need to understand how trauma affects people and know how to support their healing, right? See the widespread impact of it. We need to recognize the signs and symptoms of trauma in our clients, our families, our coworkers, and anybody involved within the system, right? We really want to integrate that knowledge about trauma into our policies, our practices, and our procedures, and then actively resist re-traumatizing people. When you get down to the core principles of trauma-informed care, safety is at the top. We want to make sure that the people we're working with feel safe. This is physically and mentally. And when I say people, I mean, those who are part of our organization, as well as those we are serving in our professional roles. The next core principle is trustworthiness and transparency. So the goal being to foster the relationship that leads to trust, which means being upfront about your role as a mandatory reporter. Don't hide that from folks because that's not fostering trust. Peer support and mutual self-help. We have to trust and empower each other in order to provide care to people who do seek us out. And then also with our patients or clients, collaboration and mutuality, that level, leveling the relationship between ourselves, by using shared decision making, taking into account what that patient needs and what they are concerned about or scared about. Empowerment, voice, and choice. So recognize your strengths of your patient and build on that and it's validating. You want to try and individualize the care you're providing to people based on what are their strengths, right? Humility and responsiveness. Acknowledging stereotypes and biases based on race, ethnicity, gender, sexual orientation, ability, citizenship, class, all the things, recognizing the impact of those as well as generational trauma and seeing the footprints of this throughout our organizations and our systems and addressing them. So, what does this look like before, during, and after? Going back a couple of slides, part of trauma-informed approach is recognizing the widespread impact of trauma. And in this case, understanding the roots of the laws, how they were developed, how they've been implemented, and overall the impact they've had on people impacted by them. So we just talked a whole lot about that. It is a deep subject. I do encourage you to do a lot more digging. As I said before, much of the work in this presentation was built upon work already done by collectives like Mandatory Reporting is Not Neutral and Just Beginnings. Forge Forward is an organization out of Milwaukee, and I believe they have satellites down in Florida somewhere. They primarily focus on transgender folks and subjects that are specific to them. Excuse me. Dorothy E. Roberts has written a couple of books. I had initially started out knowing about Shattered Bonds, The Color of Child Welfare. I shared this presentation with a colleague to get some feedback, and she was telling me that Roberts has actually written a newer book, Torn Apart, How the Child Welfare System Destroys Black Families, and essentially said, she went from reform to this system is beyond reform. We need to tear it down and start over, right? Mikkel Ross, Abusive Policies, How the American Child Welfare System Has Lost Its Way. There are some specific videos that I have used from Mandatory Reporting is Not Neutral and Just Beginnings Collaborative. They are listed in my resources at the end. The other group I would definitely call out, especially if you're in Wisconsin, is Patch. Patch is a group of teenagers that do come and talk to healthcare providers and anybody that works with teens and kind of, educates them on how to work with us, how to work with teens as a population of people. And a lot of it is kind of back to the nothing without us, right? So know your state laws. You really need to know these. You need to know, does your role make you a reporter? Does your agency make you a reporter? I just recently learned that some of the people within my agency that don't fall into those categories of mandatory reporters are considered reporters by the agency I work for because that gets them access to the education around mandatory reporting and the mandatory training that we have to do, right? Know specifically what you need to report and in what time frame. Some of the statutes will say you have to report this within so many hours, so many days, right? It is helpful to make yourself a cheat sheet that has this information or even a script that you're going to use when you make a call to the agency. Sometimes you'll call these agencies, they're going to ask very specific questions, right? Others won't. They'll let you just talk. And the more you talk and include the things you don't need to report, sometimes that can impact how this person or their family is viewed in these situations. If you believe that the laws are vague and they're unclear, seek clarity from your organization, as well as consider other local agencies or coalitions that serve populations impacted by or abuse or assault, right? You can do a search for your state laws around mandatory reporting. Myself, what I did was like Wisconsin laws regarding mandatory reporting. Sometimes it'll take you straight to the state statute. Sometimes it'll take you to an organization that what they do is they are listing the various, I'm trying to get the one. So I've got a couple of websites in my notes here, but it's going to make me catch them as two. There we go.
I can also share them. Oh, thank you. Yeah, if
Yep.
it's not working, I'll share them from your notes into the thank you email after. So don't stress if it's
Yeah.
difficult to pop them in.
Um, Elephant Circle, mandatory reporting, a guide for practitioners. That's one of them I found. The other one is childusa.org/laws. Sometimes these will be specific to child abuse. Sometimes they'll be specific to child sexual assault. It varies. One of the things that I liked about the Circle is that it did list the specific state statute, because sometimes these guides will give you like the brief rundown. Sometimes it's more helpful to like get that number, drop it in Google, go straight to the law and look at it, especially if you have to bounce around back and forth. Um, you do want to know what services minors can consent to and receive without parents' permission in your state. Sometimes you'll find that it's not explicitly addressed. For example, there is no specific legislation in Wisconsin that allows minors to get contraception without parental consent. That's actually covered by a SCOTUS case from 1977, Carey versus Population Services. However, for the state you're in, look and see, has there been any legislation? Consider Texas, where they're really pushing parents' rights. And I believe there's a case that they're trying to push to the Supreme Court where a dad is basically saying, I want to know if my child is getting contraception. I want the right to be able to stop this. So pay attention to the laws. You know, in your state laws, what's the penalty for failure to report? Who are you going to report to, and do you know the jurisdiction you're going to report to? When it comes to your organization, do they have a written out mandatory reporting policy or protocol? And if so, what does it say? If it only says just follow the law, challenge that, especially if there's any degree of uncertainty. You can ask other people within your organization, hey, how are you interpreting this? And you'll usually find that most of you are you're not looking at it the same way, right? Sometimes creating a real good policy around mandatory reporting can be hard because the more time you spend poking at it or, trying to list out what is bodily harm, what is emotional abuse, everybody's going to disagree. How do you measure this, right? The more complicated it gets. You need to know what happens when you make a report. Um, how is that responding agency going to meet with your patient? Do they come to the home? Do they want to meet elsewhere? Are parents being notified? Usually, parents have to be present before a minor can be questioned, but that's for law enforcement. Does that apply to CPS also? Um, can that person have an advocate present, right? Can they have legal counsel present? Be informed to explain how this process works when you inform your patient or client that you're legally required to make that report. And if you're not sure the best way to learn about that, contact Child Protective Services in your area. Ask them to come do some kind of formal training for you, as well as the staff that you work with, because anybody that interacts with that patient that could be a mandatory reporter, either by law or agency policy, they need to kind of have a good idea what's going to happen. What's this look like? Let's talk resources. Create and maintain a list of resources locally and nationally. Think of the most common things minors are going to need: medical, legal, food, housing, clothing, domestic violence, sexual assault service providers. The list can go on and on. Have that list put together beforehand so you aren't scrambling to gather that when your patient's present. You should know what those programs offer and are they a good fit for the situation your patient is experiencing. Does this service provider serve a particular population? Like, are they specific to the Latin community or specific to the queer community, right? And you also need to know, what does the entry point for resources look like? What's that intake process? Is it lengthy? Is it by appointment? I'm thinking of domestic abuse services in Dane County. There's the initial phone call, the initial intake, and then somebody's going to call you back later to do a much longer intake. But how much time is going to elapse? Is there a specific time? Can you arrange to call at a certain time or receive that call at a certain time? And has this person got a safe place to be when they make that phone call? Start learning a little bit about safety planning. Now, safety planning, sometimes that can be like a social worker job. Sometimes it becomes part of our job, right? but it's not necessarily sitting down and making out a plan for how to keep themselves safe in situations like domestic violence, for example, like how they're going to, if they're staying in that situation or they're leaving that situation or they've already left, what do they need to know, right? There are groups out there that will help individuals safety plan in that sense, but safety plan also can just be something as simple as who is your who's your adult, who is your safe person, who are you going to talk to in this situation, things to think about when somebody has made a disclosure to you about any kind of harm, right? Um, just glancing back at my notes real quick. Um, if you have a service provider in your area, sometimes it's helpful to connect with them just to learn a little bit more about, what they do, and is safety planning a part of what they do, and what kind of basic safety planning you can do in office before they can get to that service provider. Informed consent. When working with minors, we really need to be very upfront about our role as a mandatory reporter. Use developmentally appropriate language, right? And explain the limits of your confidentiality. So you can't just say, I'm a mandatory reporter. You have to explain what that means, right? They need to know, what could trigger a report if they say this to you. And sometimes you need to repeat it when like they may be on the verge of a disclosure and you don't know how this, any kind of report could harm that person. A quick example. Welcome to our clinic. I'm so glad you're here today. Before we get started, I just want to take a minute to review a few things. We're a confidential clinic, which means what you say here stays here, right? But there are exceptions to that rule. Like if you tell me you're going to hurt yourself, or because you're under the age of 18, you tell me somebody else is hurting you, I'm going to have to get somebody else involved to help out with that situation. And if that happens, I'll tell you first and I'll allow you to be as involved as possible. And then ask, do they have any questions about that? Sometimes you want to repeat that, about reporting because they may be on the brink of disclosing something and you just want to remind them, hey, if this goes where I think this is going, this may be a report. Sometimes it's easier for people to talk in hypotheticals. Well, I have a friend who, this allows them to continue talking about what's going on without actually exposing them to the scrutiny of an investigation, right? For those folks, make sure they leave with as many resources as is possible. You can do safety planning with them, hypothetically, of course. I'm going to drop this organization in the chat because we are running a little short on time and I want to make sure that we move on. But they have futureswithoutviolence.org. Look up CUES, which stands for Confidentiality, Universal Support, and Empowerment. Sometimes when you've got these kids that you think maybe this isn't a healthy relationship, you can kind of get into a little bit more about how to address that with them. Make sure that they leave with resources, even if they haven't disclosed that to you, right? Things to keep in mind too, when you're conducting a visit with a young person, there are things that we don't need to know, right? We don't need to know the age of their providers unless they've told us that, right? We don't need to know how many partners that they have unless you're doing like STI testing, maybe, right? There's things we don't need to know. We're curious. And this is where our biases often come in and our own opinions about sex and minors come in, right? But oftentimes there's things we don't need to know. But if they have made that disclosure, how are you going to proceed? First off, tell them you have to make a report, right? Not telling them that you're going to go make that report just erodes trust in not only you, but your overall practice, healthcare systems. Tell them that you're going to make that report, right? Because you prepared, and then tell them what you have to report. Because you've prepared ahead of time, you've got your little cheat sheet. So you're going to collect just the information that you need for the authorities. Offer to contact and bring in a support person or even an advocate if that's something that's available in your area. Something that I didn't put on the slide is, go back and tell them what's going to happen, and then try to do that planning of how they wish to engage with the authorities, right? Where do they want to meet? Would neighbors be suspicious if the cops showed up, and would that cause tension with their neighbors? Or do they have that nosy neighbor that's going to be like, oh, the cops were at so-and-so's house, right? Or maybe this is a young person, their parents are separated, and parent A is the cool parent, and parent B is the not cool parent in the patient's eyes, and they want to be with parent A, and then parent A can tell parent B what's going on so that the minor doesn't have to deal with parent B's reaction, right? Um, so sometimes you can get, authorities to meet at the person's house, or they can come to the office, or the person can go straight to wherever it is, right? Help figure that out with the patient. Um, definitely if you have some information on free legal resources, it's good to give that over to a patient so they can have somebody tell them, hey, think about these things. Make sure before you make that report, address any and all medical concerns, do treatments, testing, medication, etc. And then when you do make the report, offer to make the report with them present, right? That way they know exactly what's being said and can correct you if you got anything wrong. That's why it's best that you do this without delegating the task to someone else. But if you have to delegate due to scheduling, make sure you have somebody come in that's going to make that phone call, meet with a patient, talk about, do that warm handoff, right? And when you do make the phone call, make sure you have the person you're speaking to read back what you told them so you can provide correction on any mistakes that were made, because those mistakes can wreak havoc later on in the investigation. I've seen that happen. And also, while you're on the phone call with this reporting agency, point out the strengths of this patient, their family, because your role is also one of advocacy. If the patient doesn't want to be present, that's okay. You don't have to do them. You don't have to make them do that. Aftermath. Make sure you get releases of information for your patient specific to the agency or agencies that are going to want that information. Sometimes there's laws in the states that say we don't have to have a release or we don't have to have a warrant. You just have to give that to us. Know what the laws are, but it's always best to follow that release of information practice, right? Before you cut that patient loose, I've talked about resources over and over and over. Make sure they leave with as much information locally and nationally as possible. When you document your visit, keep it simple. Only put in what's relevant to the reason. Don't list out any additional details that could be harmful to them later, but make sure you do report who you reported to, the date and the time that you did that. Avoid anything that's legal, jargon, or inflammatory. Ask the patient to do follow-up, check in on a couple of days and be like, hey, is there anything that we missed during your visit because this big thing happened and disrupted it all, and now you're anxious and you're not thinking about, oh yes, I have this itchiness that we need to deal with, or something like that, right? Not everybody's going to answer, but you're doing what you can to kind of foster that relationship so they continue to see you as a trusted source and will keep coming back. And then make sure you debrief with your team that provided care for this patient. Seek out a supervisor, seek out an employee assistance program. Get those emotions out, right? I talked about vicarious trauma earlier. Holding that all in winds up impacting you. So the best thing to do is to get that out, right? Couple of special situations before we get to questions. And actually, you know what? We can skip this, I think. The main thing that I want to get across to people is think twice before you report. Does this really reach the letter of the law in what you have to report? Or is it any chance that your own opinions, biases, your thoughts and morality around sexual contact between minors, is that impacting your choice here, right? Is this person's race, sexuality, gender, ability different? Would you still consider this a reportable offense? And if you're not sure, get a second opinion. Talk to your boss, talk to your supervisor, seek out expert advice. You can even call the reporting agency like Child Protective and be like, so if this was to happen, and they're probably going to be a little grumpy, but they're also going to be grumpy if they get a report that they're going to have to screen out as not abuse, and then you feel bad about the situation, right? Sometimes people just up and leave before you can inform them of this, and there's not a lot we can do in those situations. So, any questions?
Thank you, Cassie. Oh my gosh, that stuff is so challenging to talk about. Yeah, if anyone has any questions, please pop them in the Q&A. I know this is a lot to think about, so you can also put questions in your post eval. You can email them to me and I can pass them on to Cassie. Like, I know this is a lot to absorb right now. Cassie, would you mind clicking to the next slide?
Yes.
Oh, yeah, so we have Cassie's resources listed. I will also, and there's going to be a follow-up email where I'm sharing all of her links and stuff. So don't worry about trying to save everything from the chat. And you'll be shared these slides as a PDF, so you can see the links there too. So if you would like to hear more about our trainings that we offer for the Midwest Trauma Informed Training Center, you can scan this QR code or email Kara at cbronick@hct.org. We'll put you on the list so you'll hear about all the trainings that we're doing that are open for trauma-informed care. And then next slide, please. And then lastly, we would love to hear what you think. Share your ideas about what other trainings you want to learn from. This QR code will take you to our eval. It's pretty short. The eval will also be linked in our follow-up email, and there will also be, again, a PDF of the slides. Does anyone have any questions? I'll leave us open for just a minute, if people have any questions they'd like to put in. Thank you so much, Cassie. You were able to cover a lot. I'm
I feel like I
really
speed
impressed.
ran there towards the end and kind of crammed it all in. So apologies for
I mean, there's so
pacing
much.
a little better.
This could be an 8-hour class, probably, like if you were going to go through all of the statutes and everything. So I appreciate you taking the time to run through everything. Yeah, we'll hang on for just a minute. Yeah, so in the follow-up email, I have the links to the legal statutes. I would say too, like, I don't know, as much as you can use, I like your suggestion of the hypothetical situation to kind of get around if the person knows your mandatory reporter, how they can approach that. That's really smart.
Yeah, and one of the things that in my notes, I had a situation one time where I had a teenager come into the ER, didn't check in, just wanted to talk to me first. And the first question was, do you have to call law enforcement? And I said, because you are a minor, if you are coming in for a sexual assault, yes, I do. And so we had her name and her phone number. That was it. She did disclose a sexual assault, was not checking in for care, gave me, and I said, and she's like, what do you have to report? And I said, well, I can't report what I don't know. And all I know right now is you are telling me you were sexually assaulted. Um, and that was all she told me. So I said, well, let me tell you about some resources in our area and things you need to consider. And I talked about where to get STI testing, where to get emergency contraception. I talked about our local rape crisis center, the RCC Sexual Violence Resource Center. I talked about, counseling and I even went over the statute of limitations and she could come back at any point for a forensic exam or what have you, but because she was a minor I did have to report. And she said, all right, thank you, that was a lot of information, I appreciate it. She left. I called the law enforcement. I said, hey, this is all I have. This is all I know. She didn't want to report. But because she's a minor, I have to call you and tell you this. And the cop was like, well, I don't think we're going to get too far with this, but I appreciate it. I'll try and call her. She called the person never answered. She called 2 or 3 times and later that night called me back to say, hey, just want to let you know I was unable to connect with this person. And that's as far as it went.
Mm, yeah.
Now, had she been a much younger kid, I want to say if she was like 16 or 17, had she been much younger, that could have gone differently. And law enforcement's going to react differently from jurisdiction to jurisdiction, right?
Mm, yeah, that's certainly gives us a lot to think about. Well, I will let everybody go, but again, thank you so much for being here and diving into this topic with us. Cassie, thank you so much for walking us through so much. This is obviously a really big topic, and you were able to cover a lot in your time. So I really appreciate all the preparation you did for this as well. Um, yeah, look out for the follow-up email that will have all the resources Cassie mentioned. And yeah, we're so happy you could be here. Everyone have a good rest of your week. Thank you, Cassie. We will talk to you all soon. Got lots of good thank yous in the
Thank
chat.
you.
Yeah, thank you, everyone.